Hi, my name is Jocelyn Bell, and this is my video titled Medi Cal, Let's Get Insured Together. I am an informative content creator who works on empowering those with the knowledge that they need to make informed decisions about their health. A lot of people think that Medi-Cal, or a lot of people don't know that Medi-Cal covers way more than they think. My goal today is to help make this program feel less confusing and more accessible to you. So, what is Medi-Cal? Well, Medi-Cal is California's Medicaid program. Medi-Cal provides a low-cost or free health insurance to those who qualify. This covers a broad range of medical services like doctor's visits, emergency room visits, hospitalization, vaccinations, prescription drugs, etc. I want everyone to think of Medi-Cal as more than just emergency help. It covers checkups, mental health support, preventative care, and as I've mentioned, vaccinations. These are all things that ultimately keep you healthy long term. So you don't have to wait until something's wrong. In fact, Medi-Cal is designed to keep people out of the hospital and give them access earlier. So, how do you get access to Medi-Cal? Do you qualify? Well, these are the basics. So, you are required to be a California resident, meet the income requirements, be a U.S. citizen or provide immigration status, provide proof of identity, and declare your filing status if you file taxes. A lot of people ask, do I need to file taxes to qualify? And the answer is no. But if you do file, you must report your status. That helps Medi-Cal determine your household size and income and ultimately determine the help that they can give you. Also, if you're undocumented and live in California and meet the income qualifications, you can still qualify for coverage. You just have to report your status and provide the information that's necessary. Also, if you need more clarification on any of the basics, you can go to www.benefitscal.com where I got the information on this side. Well, do I qualify for Medi-Cal? Are you 19 through 64 with low income, 65 or older, pregnant, blind, under 21, diagnosed with breast or cervical cancer, in a care facility, or a parent or caretaker of a child under 21? If you are any of these and you meet the income requirements, you qualify. Medi-Cal is meant to give you access. It has a wide range of groups that it applies to. I got all these groups from www.sandiegocounty.gov. So, let's say, well, right now we're looking at the chart that you would look at if you were an adult that was 19 through 64 without a disability that was applying to Medi-Cal. Your income must be at or below 138% of the federal poverty line. So, if you're a 23-year-old, you're part-time employee, you're not claimed as a dependent, you will be looking at making $21,597 or below that to qualify for Medi-Cal. Children and pregnant individuals can qualify at elevated income thresholds. This is so that these groups have increased access to Medi-Cal. If you need access to any more information having to do with the income level that you would qualify at, you can refer to this chart or you can go to www.dhcs.ca.gov. So, if you're going to go apply to Medi-Cal, what documents do you need? Well, you need identification. So, this could look like a California ID, a license, a birth certificate, or a passport, even a social security card. There's multiple different identifications that you can bring to apply. You also need proof of California residency. which could look like a utility bill, a lease, a check stub, ID, etc. Additionally, you need income verification, which could be a dated pay stub from the last 30 days, tax returns from the last year, or a statement from an employer. Immigration documents are also necessary if applicable. So this could look like INS documents or a certification of naturalization. If you need more options, because there are more options, you can go to www.benefits.cal where they do give you more options for each of these that you could bring. Also, if you don't have all the documents, that is okay. You can start your application and upload the documents that you need later, or you can mail them in. It's important to know that you don't have to wait to gather all these documents. You can get help and you can apply before you have everything. Start your application now. The earlier you finish it, the sooner that they can approve it or give you an answer back, and you can possibly get access. So, where to apply? If tech isn't your thing, no problem. You can apply in person at your local county office where they can assist you there with your application. If you don't want to go in person, that's also okay. You can go online, www.coveredca.com or www.benefitscal.com give you access to the Medi Cal application where you can apply. And also through benefitscal.com, you can check on your the progress with your application. It outlines what documents you still need to upload if you start your application before uploading or before having all your documents. You can just gain a lot of the information that you need through these sites. If you go in person, you can call for updates. You can also choose to mail or fax. So you can go through www.coveredca.com where you can print out a single streamlined application and mail it to Covered California. In this day and age, there's so many options and so many ways that you can get access. It's so important that you look through all these options and choose what's best for you. It's important that you choose to get access. So, when do Medi Cal benefits start once you apply? The state is required to decide within 45 days for a Medi Cal application. With a disability, this process will likely take longer. The process can take up to 90 days. If you are approved with coverage, it usually starts on the first day of the month following eligibility determination. So, if you applied in March and you heard back in March, because there is a possibility that you will hear back before the 45 days or the 90 days, then you would be looking at getting your benefits on April 1st. So, also, retroactive coverage is another huge help. If you happen to get care before you got coverage or before you applied to Medi Cal, this feature goes back to 3 months and it can help you cover those bills if you were eligible during that time. It's a lifesaver. Make sure that you use all of the resources that you have with Medi Cal. Your health should not wait. It's so important to apply now and get the help that you need. It is thought of to be, oh, I can't get Medi-Cal because I have a job. It's not about being unemployed. It's not about being employed. Anyone can get access to Medi-Cal as long as you meet the requirements, the income requirements. This isn't about coverage, it's about equity. Medi-Cal is important when you're looking at closing the gap between who can afford care and who needs care. If you've ever skipped a checkup or delayed treatment because of the cost, you're not alone and you shouldn't be ashamed. This is why programs like Medi-Cal exist. And this is why the message that I'm giving you today is very simple. Your health should not wait. It's so important that you take the steps that you need to take and that you get access to care and that you apply now. Thank you so much for listening to my video. You can go back and you can look through the slides. It's important to look through the resources. You can gain access to many of the resources that I have. www.benefitscal.com and www.covercalifornia.com have step-by-step processes to how to apply for Medi Cal today.